What's up, y'all? It's Ashley.
I'm Fee.
It's Melody.
And Cody here. And you've tapped into
The Mama's Den.
We're all mamas, and we've got 11 kids between the four of us. And let's just say we are tired. But we're also friends who are going through this journey of motherhood together.
Each week, we are giving you some laughs, maybe some tears, sharing our personal stories, and of course, giving advice, what we hope is helpful.
This is the show we wish we had before becoming mamas.
So grandmas, aunties, sisters, uncles, daddies, brothers, everybody who's in the village of raising children, we got you.
Shall we get into it, ladies?
Let's do it.
Welcome to the Mama's Den. So this week we have a special guest because we are celebrating and honoring Black Maternal Health Week, which takes place from April 11th through the 17th, founded by the Black Mamas Matter Alliance to be a week of awareness, activism, and community building aimed at amplifying the voices of Black mamas and bringing visibility to Black-led maternal health initiatives. Woo woo, which we all are super passionate about. But we want to make sure our audience knows the realities of the Black maternal health crisis.
Yeah.
As we just talk about our own experiences and the expertise of our guests.
Mm-hmm. In the U.S., Black women are 3 times more likely to die from a pregnancy-related cause than white women. In the United States, 29 to 44% of Black women experience postpartum depressive symptoms, also known as PDS, yet few are properly identified and or connected to mental care services. Let's see. The reversal of Roe versus Wade was exacerbated disparities in abortion access for Black women and birthing people. Black non-Hispanic women accounted for the highest proportion of abortions in 2021. Black women have a higher incidence rate of cervical cancer compared to women of other racial, ethnic groups. That's very deep.
I think it's important to be aware because I think that it reminds us to prepare ourselves.
Yeah.
It reminds us to take our health seriously at every stage. And especially as birthing folks. And so I think that all of us have our journeys with how we prepared or didn't prepare for each of our pregnancies. And so for me, as morbid as the statistics are, I think it's important to be aware so that we can actually build our communities and our tribes and our groups of women and partners to talk about these things with and to make sure that we have each other's backs.
Yeah.
That's my 2 cents.
Mm-hmm.
So that said, our special guest with amazing expertise on the subject, mama of 6, Kim Durdin, grandmother of 5, midwife, doula, lactation consultant, co-owner of, now you have to tell me, is it the only birth center in California? Only Black-owned birth center in California?
As far as I know, 2 Black-led birth centers in California, both in Southern California. So one is ours, which is Kindred Space LA, and the other one is my girlfriend, my dog, Nikki Helms, has a birth center, San Diego Community Birth Center in San Diego. Hopefully we'll have more in California. We have one trying to make its way in Oakland, a midwife named Kiki Jordan, and she's working really hard to pull that together. I also got another job, y'all.
Uh-oh.
I know, right?
All these kids, all these babies, and another job.
I took on the director position for a network engagement for Birth Center Equity. So they're an organization that is working to bring BIPOC birth centers, build them and help them come to fruition around the country. So we have like about 39 birth centers around the country in the network, and we have one in Puerto Rico that's building, and we're just really, this organization formed to help folks get these kind of places off the ground in response to what's going on out here.
So you're fundraising, I assume? Like,
what
are all the ways we can help?
Yeah, Birth Center Equity is a nonprofit, and they are raising a lot of money. They're doing good with raising the funds, but their goal is to raise about $22 million this year.
Oh, wow.
And I think they've raised about $4 million this year, but they've been in existence for several years. And one of the founders, Leslie Welch, is building a birth center with her partners out there in Detroit. Birth Detroit is coming through. Another one of the partners, previous executive directors, is building a birth center in Boston, neighborhood birth center, and we're supporting birth centers all over the country that are coming up through the ranks.
That's amazing.
Yeah. So that's my second job, and I'm actually working on a third job.
What's your third job besides writing this
would be
book that
like
we've
your
been talking
10th
about for
job.
I
years?
know. We're opening a second location of Kindred Space
Yay!
LA. Yeah.
Wait, where?
Congratulations.
Well, it's going to be in LA County,
Okay.
but not LA proper. We're actually opening up in the Antelope Valley.
Oh, girl.
Where is
Where
it?
is
As a
that?
Texan, I have no idea where that is.
It's do you know where Santa Clarita is?
Yes.
Yes.
So it's
Oh, you
like
up by
on the
me.
on the other side
Oh,
of like the
wow.
Los Angeles forest, and Antelope Valley is another place, unfortunately, around the country that has a maternal healthcare desert.
Yeah.
So they had I think they had about 3 birthing hospitals out there. They now have 1. It's a very vast area, and it's pretty diverse. I think there's about 30% African American, about 30-something% Latinx, and then white folks. And so we have a good variety of folks, and there's not really a lot of services. So we're actually taking over an existing birth center
Yeah.
and working with some community partners here in Los Angeles proper to make it come into fruition. The other problem out there is that there's not a lot of birth workers, not a lot of midwives. So we're figuring it out.
Yeah, I was going to say, so what do you do about that? You can build the birth center, but how do you make sure you have the people?
Right. Like, well, you know how it is. It's just like everything comes together like it
Mhm.
should in divine alignment, right?
Mhm.
And you just, seeds get planted on our journeys all the time,
Yeah.
right? I
Yeah.
know y'all can speak to that. And this is not a new journey for me. I've been working in maternal health even before I knew that's what I was doing,
Mhm.
And really, when I had my first kid, I really opened my eyes to this world and helped me see a new way of being that I wanted to be in this world. And Yanni is going to be, I think, 33 this year, or 34,
Oh
my eldest.
God.
So that's like, I can look at her life and see that as like my marker for
Mhm.
coming on this journey
Mm.
and planting seeds along the way. But truthfully, when Allegra and I opened up Kindred Space LA, we knew that AV was struggling and really lack of services, struggling with the lack of services. And
Sorry, did you say AV?
AV,
Oh,
the Antelope Valley.
There we
That's
go.
what we
Okay.
call
Yeah, I
the
was
Antelope
like,
Valley, right? So it's like Palmdale, Lancaster.
Yeah.
Anyway, so we knew we had planted a seed that, that would be a good place to have a second location because people, it's a dire need.
Mhm.
And so it didn't happen right away, but it just things lined up for that to kind of start coming into fruition. So
When
I
I met you, we
yeah,
were in your house,
yeah,
not Kindred Space LA. We were in your house taking birth classes,
right,
dancing with Dancing Moon,
yep. Who's
still going.
with us and actually in midwifery school now. She's becoming a
Wow.
midwife, so I'm her preceptor. I get to teach her. I know. And when we were in my house when I met you, that wasn't the first incarnation of anything. And that was
Mhm.
like,
Yeah.
it's like when Yanni and Shelby were little, and Shelby just turned 30.
Mhm.
When they were babies, I was talking to God, like in my house in Brooklyn, like, oh my God, like, how am I going to do this? First of all, how am I going to raise these kids in this world in the way that I want to? And also, I need to make some money.
Mm-hmm.
How am I going to do this? And I was visioning a center way back then. So we're talking about 91, 90. Shelby was born in 94. Visioning the center, visioning this place where families, women in particular, people, especially I was thinking about women home with their kids, and they just want some place to go.
Mm-hmm.
And you know where you end up being? At the mall,
At the mall.
spending some money that you don't have.
That you don't have.
Mhm.
And it's like that's a little trick.
Yeah.
Mhm.
This consumerism thing that we're kind of
Yeah.
like, oh yeah, there's a little play area at the mall, but
Yeah.
you're gonna have to buy some food.
Mhm.
You're gonna have to, and it's like I realized there was no place for, I'm saying women, but I mean families. But I was
Mhm.
thinking about people like me who were home with their kids, and where do you go and just be able to whip your boob out and feed your kid, and it's cool.
Yeah.
Mhm.
And they could also get some food, and you can also just chill, and it's just okay to be. And I just started visioning this place, and I clearly heard Spirit say to me, okay, well, if it takes you about 25 years, do you still want this?
Mm.
Mm.
And, I was like, I don't know.
25 years.
Do I? It seems so far away.
Right.
But really, in essence, that's really what it took to actually incarnate the physical space. And now we all know that 25 years goes by like that,
Yes.
right?
Mm-hmm.
So, I'd love for us to talk about, our first pregnancies and what it was like preparing for those. For me, I grew up in a family of doctors, which y'all know, but when I got pregnant, none of them were here, though my uncle was here for many years and left the year before I got pregnant. And so I was just trying to figure out what I wanted to do. As I had been familiar with midwifery because of a documentary that I knew the producer of. And it was very much a white documentary about Anna Mae Gaskins and the farm midwives. So it felt like a very white thing for me. But it was still in my mind. I thought it was a really beautiful experience to observe. And so as I started to explore midwives versus doctors, what's the difference? What does it mean? Ultimately I decided to work with midwives, and I wanted a Black midwife. And I sent every email to every doula I had ever touched, talked to, seen on the internet, and trying to find you, ultimately you. And there was a yoga class. I wish I could remember this woman's name. There was a yoga class, and the instructor was ultimately who led me to you. But at that time, Kim, you weren't yet a midwife. You were a midwife in training.
Right. I was a student. Yeah.
Under Heather Schwartz. And so I worked with Heather to work with you.
Yep.
Love Heather. And so my preparation was just sort of figuring out that was the path I wanted to go down, but only with a Black woman. And there you came into my life.
Yeah. I think 2 or 3 people reached out to me
I'm sure.
around the time you were looking. Because Ashley Nicole,
Yep.
she reached out to me too. And
she was the only Black woman I've ever met that worked with midwives.
Yep. And so that was, I don't know. It's just God brings people together that are supposed to be together, And I mean, ultimately, you didn't have a home birth.
No. So yes, we were attempting a home birth with Brooks, and we tried for a long time.
We did.
And I had this sharp pain I went into labor at like 2:30 in the morning.
Yeah.
Or it lost my mucus plug. And you guys came over at 6 p.m. And then by 2:30 the next morning, that's when this pain just would not go away. Yeah. And by 6 a.m. is when we went to the hospital. Yep. Because I just couldn't do it.
No, it was good. And it was just, that's just the way it needed to be. But, and I think that's one thing about home birth or out of hospital birth that people have questions about. It's like, what do you do if something, goes wrong or something's not right? And we're actually really conservative with out of hospital birth. So it's like, if things ain't really lined up, then we're going to go in.
Yeah.
And, and that was the experience. And also that it doesn't end with the birth. And so many times we're all so focused on the birth. Not that that's not important and that we shouldn't plan for that, but especially for a first baby, you don't really know what it's going to look like on the other side. Like, there's a baby in there, but in real life, baby, no. It just doesn't click until they're out.
Yeah.
And then you're like, oh, that's why we had to do all this. So you could get here.
Yeah.
And then it's a totally different shift, right? Because, because we don't have the concept of the baby on the outside yet, it's like all we can do is focus on the birth. But the postpartum is so important. And I think we got to really, really, really be able to support you in the postpartum too, because there were some challenges. And I think that's the other piece about midwifery care that's super cool, is that we're very invested in the postpartum.
Yeah.
We check on you a lot.
The way that I forget that I had postpartum preeclampsia, I forget all the time. I literally went back to the hospital a week later.
Wow.
I know.
And to that point, I just want to say that 50% of the maternal deaths are happening in the postpartum. So this is where we have to really talk about how do we support people postpartum? And there's chatter about it in the mainstream world, but about people having more visits with their provider, with their doctor, but it actually hasn't happened. So typically you give birth and then 6 weeks later you see your doctor. So much happens in that first 6 weeks, including you could die.
Yeah.
Including you could die.
Yeah.
Who's checking your blood pressure? Nobody. You're just home.
Right.
So unless you have somebody checking on you, following on you every couple of days, to see what's happening, what your symptoms are, that's how people fall through the cracks. Postpartum hemorrhage, after you already got home, is another way that people die. So somebody bleeding out at home, right? And again, we don't even give enough. So just want to go to midwifery care. Traditionally, we're seeing people at least 4 times before 6 weeks. And we're in our practice, we're on 24-hour call for all of our clients. So I think we had about 4 babies in the last couple of weeks. And we call them, checking in on them every other day at least. Like, hey, how's it going? How's it going today? How's it going today? And they're never annoyed.
Oh no.
No.
They're never
Can't
annoyed. They're like,
Somebody check on me, please.
Right.
Yes.
Like,
Yeah.
I'm going through a lot. Like, that must feel great because
Yeah.
people don't think about it from that way. That, you got this baby, you're taking care of. It's a whole new season of life. But, the true aftercare of like, have we certain questions like,
Mhm.
how are you feeling physically, mentally, emotionally? These questions actually need to be asked. And then when you get
exactly.
asked by somebody who's been with you on your journey,
Yep.
how much more meaningful that is. And I think it's different from a spouse or your girlfriends who've had kids. This is somebody who's caring about your physical, mental, and medical health. Truly,
Right. It's a clinician. It's a
clin-
clinical person
absolutely.
that's looking at all the clinical markers. And I'm so glad you mentioned mental health because we know that's huge.
Mm.
And no one is getting support. And I don't like to sound doom and gloom. Like there is change happening, and I want us to remember that and not get overwhelmed by all the grief and the heaviness
Mhm.
of the dysfunction.
Mhm.
We, I don't know if there's a really great documentary with Nikki Giovanni. Anybody watch it?
Going to Mars, the Nikki Giovanni project.
And I mean, I think what I love so much about that documentary was just this idea that we have to keep our eyes on the future. We have to keep our ideas and our dreams they can be and they will be out of the box. They're not going to follow, they're going to not look anything like what's happening right now. We have to go beyond in our dreams.
Yep.
And Nikki Giovanni talking about going to Mars and Black women. I mean, I was like, exactly.
Yeah.
Like we have to be on that level with our spirit, our soul, and our dreams. And what's done is done right now. But it's like what's coming, we have to really continue to keep our eyes on that. And not just keep our eyes on it, but like dream it
Yeah.
to be able to focus
And if it takes
on
25 years, hang in there.
I know,
Yes.
right?
Just like you said.
Because as your kids going to benefit, your grandbaby's
Yes.
going to benefit.
Yes.
Just like we're benefiting. I mean, if we really were to really sit here and think about what our ancestors have gone through, regardless of the doctors in your family, like that's a whole journey talking about how they got doctors in their family.
Yeah.
Okay. But if we really think about what they went through that we can't even fathom, but we're here. So it's true. We are their wildest prayers. We are the prayers of our ancestors, and we have to keep moving that forward. So lest we read these statistics and we just go slit our freaking wrists.
Yeah.
And that's kind of, don't you think that's what people would like to happen?
Yep. No, I always say that too because I feel like a part of me was like, let me have one more baby so I can have the birthing experience that I wanted to have. Like, honestly, I'm like, this time it's going to be, none of them were the birthing experience that I wanted to have. But it's funny because in my mind, I'm already planning for my daughters and my granddaughters because I'm like, whenever I don't obtain something, let me get all the knowledge I can. Let me get all the resources I can so that when my daughters have babies, they have the birthing experience that I didn't get to
I love
have.
that.
And then their daughters and so forth and so forth. So just like you said, I think that's like the promising thing as a community is that we always have to realize when something happens within our community to us, our friends, to gain that knowledge so that it stops happening.
Yes.
Instead of just stopping there, like, this is a horrible experience. I always think of you, Felicia, because you're like your first birthing experience and didn't go the way you wanted, but you made sure with your second baby, like, I'm going to make sure that I pay attention to all the things that I needed the first time. The second time around, I'm going to have all those resources so that I can have a completely different experience.
Yeah, 100%. I definitely wanted to be proactive instead of reactive, and the first experience, I was so confused I had this beautiful baby and I had, everything was lined up, but I just couldn't lean into the beauty of it. And I was like, after it's like, oh, it's postpartum depression. I was thinking about this the other day. I remember calling like a hotline because I just felt like, when people, they don't know, but they give you the answer of like, no, you're so blessed. Like, you have this baby, like focus on that. And you're like, I can't focus on that. Like, I need a lot of help and support here. So yeah, it was definitely like super challenging. thank God she's my piece. I'm like, man. But yeah, second time around, I was like, I'm not playing no games. Yeah.
Yeah.
No.
I'll say that too, because I shared both. Well, I haven't shared my second birth story, but with my first, Cameron, I ended up having to have an emergency C-section. I did have a doula and I was in the hospital, but there were some things that were happening there that, to this day, I really never got clarity on until I had my second child. And Kim also actually assisted me remotely in empowering myself and having that journey. And so, that the second time around, I wanted to have a VBAC, which is vaginal birth after cesarean. And the primary care doctor that I was seeing told me that the practice did not support VBACs. It wasn't a personal thing. And I was like, well, this is my personal journey. How can you tell me I can't have a VBAC? Like, I'm checking all the health boxes. It's been 5 years since my last pregnancy. And Kim and I actually met through a women's, it was with Cassie Ventura.
Uh-huh.
She was getting ready to have her baby and we did like a mother's celebration, and that's where we met the first time. And then Cody, again, the connector, came back. So when I encountered this obstacle that said I couldn't have a VBAC, I was like, you can't tell me what I can't do. I'm not taking no for an answer. And Cody was like, you should call Kim. I was like, you know what? I met Kim. Should. So Kim was like, listen, girl, I got too many babies on the horizon and you live 800 miles away, but let me direct you in the right direction.
I said it just like that.
She did. And she did. And the thing was, she recommended doulas for me. She recommended midwives and birthing centers that were close to me in my area. And she recommended an OBGYN. And I just got goosebumps thinking about it because I think that that's something that's really important for people to understand, is that these resources are not just there for you to be like, I have to go this way,
Exactly.
but they're there to support, to help educate you on finding what is best for you.
Exactly.
I ended up interviewing the midwife in the birthing center, which was 7 minutes from my house. And I felt so good about it. I was like, oh, I'm going to do this. And then I met my OBGYN. And something in spirit was just like, she was a Black woman. She did house calls. She came to my house. Something about that OBGYN doctor was just
She's
magical.
super special.
She's
super special.
Super, super special. And I met her and just something was just like, I know you were going for a, birthing center thing, but I was like, I feel like this is who I'm supposed to go with. And shortly after I said yes to her, I found out that I had developed placenta previa.
Yep.
So I wouldn't have been able to vaginally birth at the birthing center anyways.
Yeah.
So and then I was in the care of this wonderfully talented and gifted doctor in the hospital where my son was born, having a completely different experience where I felt empowered and supported, even though I was having a scheduled C-section. It was a different, but I felt the care that I had. The care was definitely there. And even some of the post-operative care when I was in the hospital, some things that I was like, oh, like, I don't really like that. I would tell, the doctor and she'd be like, I'm going to tell them to back off of you. Like, she had my back. And so that's really, really important that, we understand that you have to advocate for yourself. You have to ask questions. You can have an idea of how you would like things to go. And you have every right to exercise to try to achieve that for yourself so that you feel protected and supported in one of the most important transitions and experiences of your life as a birthing person.
No, absolutely. And you're 100%. And I think what's hard sometimes is people feel like they don't have options or choices. So, you're a certain type of person. And I think to your point, it's like we all go through that first experience. I have that first experience story too. And you can use that to try to get a little bit more of what you want for the next time.
Yeah.
Right? Whether it's the research or see where you weren't supported and try to get that support. Like, more of what you might need because you did the thing, right? But I think that everybody, no matter if they are on county, state insurance, or they have private insurance, which to me shouldn't be a thing. We should all have good insurance. We shouldn't be up here talking about good insurance. You got good insurance. You got not good insurance. That drives me insane. But all that to say, you can look around. I have some of my favorite physicians that work in the system are taking Medi-Cal and things like that. They're working in hospitals that are kind of in the hood, right? Because that's where their calling is. And they're providing amazing care. So, like, to Melanie's point about asking around and to Felicia's point about asking around and resourcing, do it. Like, and if something doesn't feel right, like talk to somebody about it.
Yes.
Anybody, even if you go into a place, a space to get care, and you connect with one person there. Maybe it's not the doctor, maybe it's not the midwife, maybe it's not the doula, maybe it's one nurse that you just talk to them. And you know, we do have a plethora of resources and things online now. And there's some, I mean, one of the resources I give out all the time is Postpartum Support International, or PSI. PSI, you can call them, talk about hotlines. They have a hotline to deal with any kind of mental health
Love that.
issues that are going on in the maternal maternal period of like even prenatal, right? It's called Postpartum Support International, but they have prenatal support, postpartum, et cetera, different groups. And they're a really good starting point for people who know they need support. They don't know who to call. You can simply log on to that organization. It's really awesome to start.
There's also it's 1833 TLC Mama. Have you called that one before?
I haven't.
So we just made a shirt that has it, but to bring awareness to just mental health in terms of motherhood. But when you call, you're led to a hotline that you can talk to them about like postpartum. And so
What's it called again?
It's 1833 TLC Mama. But
I think I've heard of them.
Yeah, it's like, it's just so lovely though, because you just have somebody to, sometimes I think also, like I was saying, not everybody knows what to say in those moments, especially if you haven't dealt with your own experience of having children. And so they have the words and they have the, like, let me guide you here, you know, this, what you're talking about sounds like postpartum depression, and maybe you should talk to whoever it is, you know. So that's another really good little hotline.
Yeah, they don't just, you don't call them and they're like, oh, you'll be fine, girl.
Yeah, no, they're giving
they're
you,
trained.
like, yes,
you know?
yeah.
Have a cookie.
Absolutely.
Go take a nap. You'll be fine.
I keep wanting to cry, and I want to say why, so that I don't just start crying and then y'all are like, what's wrong? But part of it is that I hope that you recognize like just how much of a wealth of, first off, just wonderfulness you are, but you, because of your wealth of information and expertise, it's not just like, obviously you've worked for 30 years to have the birth center that you have, that you built in only 7, because if you know, I know when Brooks was born, that's when you actually became a midwife shortly thereafter. But like to be able to provide Melanie and me with doctors when we wanted VBACs, and we're just 2 people, but everyone that you're able to provide doula options to, lactation consultants, doctor options, that you're able to both say, I got a million births going on right now, I can't really deal with this exact thing, but here's 15 more people who can. Like so many lives that you've impacted, and I just hope that you know that.
Y'all, what
Because
are
I
you
don't know
doing?
if you do.
No,
just
it is the truth. The Kim is a extremely special person, human being on this planet. Her
Thank Black women.
thank Black women. Her ability to have endless energy for the work that you do and the people and the lives that you touch, even on some small way.
Yeah.
Because even on that journey, you still called and checked on me. You just remembered me out the blue. Hey, I was just calling to check on you. It meant so much.
Oh.
And I've encountered you in several ways, you know, now at this point.
Anita Baker concert.
I mean, we were at the Anita Baker concert together. We also are on an episode of Recipe for Change,
Which is coming out
this season, talking about Black maternal health. And I called Kim for that because we had you know, I was invited to have this conversation. I was like, we can't have this conversation without Kim.
That part.
Like, she has to be there. And I want you to know that that's a reflection of who you are and the impact that you make on people's lives and why you are a unicorn that everyone needs to know about.
Agreed.
You know what I mean? And so to have a community and a platform to ever say your name is important. And I want you to know that the legacy of your work, and I know that that's what Cody is saying, it lives in your children. It will live in our children's children. What you're doing, the ripple effect of what you're doing is something that is the future that we're talking about, is the Mars.
I can just die right now.
I'm like, we do not mean that.
I feel cheated. I feel cheated because I didn't have the Kim experience.
Oh, I know.
You know
Well,
what?
she
But
actually
you are
will.
getting the Kim experience.
Peace will have
No,
the-
I want the
okay.
one when I got the baby in my stomach and the postpartum.
Well, you got one more baby in you, maybe.
We'll
So,
see. But if it
not
is,
right
I'm
now.
definitely.
The shoulder shake.
No, but Kim
Yeah.
actually reached this. Oddly enough, do you know that you would like DM me after each child? Like, I don't know why you didn't call me, girl.
Hilarious.
Every single time she'll be like, I mean, you had that experience, but I don't know why you didn't call me, girl. Each time, but the first three, well, the first two I had them in Anaheim, so I was too far.
Yeah.
And obviously I had a mirror, but I love what you said about resources as well, because I do want to bring this up. I had a mirror and I was on Medicare. Was it Medicare? No. Is that what it was called? It was insurance for poor people. But either way, it was insurance for people that didn't have money. And when I first had a mirror, I was young. I moved back from New York. And I just didn't have a lot of money. So I was sent to like the community doctor, and you just see a different doctor every single time.
Yeah.
But the irony of it is that they sent a nurse to my house after I had her. And she came
Yeah.
and checked on me. And
Yeah.
it was like 30 days or something like that. And they're like, we could come as often as you want.
Yeah.
And so the reality is there are actually
Yes.
a lot
There are.
of resources for people that are, I hate using the word poor. We have to find another word.
Low
Don't got a lot of
income.
money.
You can say low
You do
income.
like to use
Low,
that
I
word.
feel like, but low income sounds worse to me because that is how I lived in
income.
low income housing. Like to me, I don't know. I'd rather be called
Well,
poor.
my
child.
dad would say, I would say to my dad, I'm poor. I ain't got no money. He's like, no, you're broke.
Okay.
You're not poor.
Okay.
There you go.
Broke
So,
people.
You broke.
I
broke
don't feel
people.
like any of us like any of these.
But your
words.
point is that there are resources at every level.
Yes.
Yeah.
But
100%.
now that I have money, it actually is sometimes worse for like middle class
Right.
because
No,
you
it
have
is.
to pay out of pocket.
Agree.
Your insurance doesn't cover a lot of this.
girl.
And I'm
Exactly.
saying that's as someone who's come from that environment, from low income, poor, whatever you want
Right.
to call it, that don't feel like because you don't have a lot of money,
Right.
that there are not resources for
I mean,
you.
to your point, I just want to plug that Medi-Cal in California pays. If you're on Medi-Cal in California, Medi-Cal will pay for your doula. They have Medi-Cal doulas now. So,
But they
and
pay for what's it called?
they pay for visiting nurse,
Yes.
like you're talking about. So we have Nurse Family Partnership in Los Angeles County, and just Google it or call 211, and you can sign up for the Nurse Family Partnership, and you can have a nurse that visits you. I mean,
Yep.
and different programs that will visit you for up to 2 years.
Is
Wow.
211
Care source.
That's amazing.
Care source.
Care source.
Care source.
Wait.
That was the name. Sorry.
Is
Go ahead.
211 a California
It is a
resource?
California
Okay.
resource, but I encourage wherever people are listening to look into your
Yeah.
state maternal health resources because every state has different things
They
going
do.
on. And it's unfortunate that, I mean, they're doing the best they can at pushing the information out there, but it's almost like it's almost impossible to reach everybody. And so you do have to search for the resources, but the ones that I'm talking about are really good. And also there's another national resource for mental health. And now my whole thing is that you could be having mental health around your maternity time that, so kind of like a postpartum depression or prenatal depression or whatever. And you can call that number. But let's say your partner is going through something. Your kid is going through something. This is for everybody because we do understand in this country that, that mental health is a huge, huge issue that is not getting addressed. What is it?
It's 741.
No, that's not it. 988. That's it.
Oh, well, there's also 741 is also one that you can text if you are in crisis. Just National
can
Suicide
text-
Prevention Line.
Well,
You
yeah,
can
that's
text-
the suicide
that's-
prevention
okay.
line, which is amazing because
Yeah.
we need that. But
Yeah.
the 988 is for like everything,
Okay, good.
everything and everybody. You're not feeling well mentally, you can call this number and get some services. So yeah, and as a matter of fact, just because I have to stay up on this stuff for our business, that we do know. One thing that I didn't really anticipate would be a part of doing this work is how much advocacy work I also have to do side by side with taking care of my families, right? So there are a plethora of organizations and collaborations that I get to participate in. One is the Maternal Mortality Review Board of California. Every state has a maternal mortality review board. This reviewing deaths of mothers is the most one of the most traumatic and rewarding things that I've ever been able to be a part of in the last 3 years. I was invited to that by my sister friend, Dr. Saida Pepra, who's an amazing Black psychologist, and does frontline doula. She's frontline doula. Anyway, she invited me on, and that is just, I mean, that's where you can't deny that there's a huge problem in this country, and there's a huge problem in which we deliver care. We can have all the sound bites we want, but when you actually read cases, I mean, things like where people, we're talking about listening to Black women, that's real, because women are coming in saying something is wrong, and people are dismissing them and saying they're combative, and then they die. Working with midwives we have I think 8 different states where midwives are working to change how Medi-Cal pays them. So because one of the reasons why we're having an issue with not enough midwives is because literally we don't have enough. And also, especially for us out of hospital folks, there's very poor reimbursement, honestly, for all maternal health providers, from their OB to your midwife. We're really not getting no money. And so if someone has public insurance, which is the majority of people, and their doctor's getting paid $19.99 for their visit, that's why your doctor will see you for 5 minutes. And that's why 40 to 60, they're seeing 40 to 60 patients a day, because that's how you make this Medi-Cal system work. So the truth of the matter is not just broken for midwives, it's broken for everybody. And we have to change these rates, and we have to turn to value-based payments, because when we have good outcomes, you don't get paid for that the way the system is set up. You're actually paid more for the more stuff you use, which essentially is the bad outcomes. You have a C-section, yes. You're not necessarily the doctor, but the facility is going to get more. And the more ultrasounds you do, the more tech you use. Sometimes tests are ordered, in particular ultrasounds, and the moms are freaking out because they're like, why do I need all these damn ultrasounds? And they're like, just come back and we're going to do another ultrasound. Well, why? Because they can get paid from insurance for the ultrasounds, because the way the system is set up. So those ultrasounds, the insurance might pay over $1,000 for a 10-minute ultrasound, but they're going to pay the doctor or midwife $19.99 for the actual appointment. Do you understand?
Yeah.
So everybody's figuring out how to work the system, and they're pushing people through this over-medicalized system in order to get the reimbursements. Not to mention, if you have a C-section, then your baby's more likely to go to NICU, which is big money to be made from insurance companies with your babies being in the NICU. So that's the way our system is set up now. It is the truth.
Yeah.
I am not making this up.
Oh, we know.
And so what needs to change is that first of all, we pay clinicians what they're worth. And then also we give, you have more reimbursement for better outcomes. It can't just be based on all the technology
And
that
that's
you used.
governmental.
Yes.
So for us, it's advocacy, voting.
Exactly.
I mean, there's nothing else that we can do.
Exactly. Well, yes. There's a lot of really great groups of moms that are organizing, like Chamber of Mothers, who are working really hard also on the maternity leave piece. That's another piece. We ain't got no maternity leave. Okay, really, we're set up to fail. But there are people out there who are working. And then again, we got to talk about the Momnibus Act.
Yes.
Momnibus Act, which is this piece of legislation we keep coming back trying to get it passed for the country. And just Google Momnibus Act, figure out how you can support that, because it's really about dealing with these disparities. And you guys know Charles Johnson, and you should probably have him on if you haven't already.
Yeah.
But Charles Johnson, who lost his wife at Cedars years back, is such a huge advocate, and you can even connect on
His
page.
organization is For Kira
for Moms, like the number 4, For Kira, Kira, for Moms. So these are ways that we can get involved, and you have to, because when we say it's broken, it's not hyperbole.
Right.
It's real.
It's broken. Women. For everybody listening, and I think we all have an experience because we've talked about this, but for anybody who is listening, why is there a Black Maternal Health Week? And what is it, in your opinion? We can all kind of surmise it down to one thing, but what is it that you think is the challenge with Black women specifically when it comes to Black mortality in birthing?
Well,
because some people are going to be like, well, that's not, what is it? Like, why is it Black Maternal Health Week? Like,
Yeah.
your experience in working in this. what is it that Black women are facing and are up against specifically? And we read some statistics, but
Right.
you know.
Well, I just want to say that when I came in today and seeing all of you guys, I'm from Jersey, we say guys, seeing all of you guys,
It's fine.
and just like the joy and the happiness and the hugs and the love is so present. And then as soon as we started talking about these statistics, it's just kind of like it got real sober, real somber, and because this is a real thing that's happening, right? And so, unfortunately, maybe if you're on the outside looking in, you could say, you know, those Black women just ain't taking care of themselves. You know, if they ate better, if they sang songs like they did back in the slavery days, if they grew their own food, if they just did a better job of taking care of themselves, that these things wouldn't be happening to them. But I'd like to remind folks that 83%, this is the statistic, 83% of the maternal deaths that we're seeing are preventable. So, and so sometimes the conversation gets turned around like we're just these walking risk factors. I mean, you can see a lot of things that we might prescribe or want pregnant folks to do if they're Black, because we have African American as a risk factor. And so unfortunately it gets twisted that we're just sick, unhealthy people. But we're not talking about, are we talking about the intersection of what they call the social determinants of health, all the other things that come into play, like maybe we aren't eating well. And I'm here to tell you, we're not. Some of us are really not. Some of us are really dealing with, but where are they going to go grocery shopping if there's no store nearby? The liquor store? Yes. They're going to go to the wherever is convenient. All the different, you know, we can just go down the list of all the different ways that we're impacted in our lives. Just the constant stress of being Black in America is one of our stressors. It's not our fault, but yes, it does make us more stressed. And you know, I think what surprised Allegra and I when we opened Kindred Space LA in the heart of South Los Angeles is the level of challenge that folks are having to live a healthy lifestyle. And that there's also a lot of miseducation about a healthy lifestyle. Like, no, if you eat fruit all day, that's just not a healthy lifestyle.
Girl,
you know,
or
you
a
got
cup of milk.
or or whatever. I mean, there is a lot of, you know, we don't even talk about eating disorders in African American community, or what I like to call sometimes disordered eating, like, because we don't see that as being a problem that we have as Black people. I didn't think of Black women suffering from challenges with eating. I thought from the after school specials, it was white people that had anorexia or all the things. But we have that too. And it doesn't, you know, you have to spend more than 5 minutes with a client to really get to understand a little bit more of their deep history and continue to make space for understanding that and holding space for them as they navigate the stuff. This is not an easy place to live, this country. If you talk about even the city, a lot of us aren't living near parks. I know, because I live in the hood and I have to drive to a park. I have to drive to find some grass somewhere. And, you know, but I might find the grass, but what about the air quality? We're not talking about the factories. We're not talking, I know, because I live in the hood. I come from the suburbs now, and I live in the hood. And I paid a lot of money to live in the hood. But the truth of the matter is these things impact us. These things impact our partners, our families. We're coming from families that have been, you know, we have this, people talk about the generational trauma, right? And, you know, that's there. And of course, we have our generational strengths, which is why we're still here. Okay. So we, you know, again, it's like a collective. We all have a part to play in healing, and we all know it starts with ourselves. Right? It starts with ourselves. We have to do our healing, especially if we're a mom or we're becoming a mom, because now when our babies come, we're either going to pass all that stuff on or we're going to break the cycle. And you know, I remember when Yanni was a little baby, she was like a year old. We were living in Brooklyn, and I was making like baby clothes, because I used to be a fashion designer, y'all.
Girl.
I used to be a fashion designer, pre-kids, all that.
And the next episode of the Mama's Den, the many lives of Kindred.
And after I got out of the industry and I started making clothes at my house, making kids clothes, I was really inspired in African prints, and Yanni was my little model, you know, so cute. I remember I went to this first event to sell clothes on the street in Brooklyn, and at Dance Africa, this thing that
Oh,
happens
I
every
love
yeah.
Dance
You know how they have the festival?
Yes, yes.
So,
That was
and
the
that's where I
best.
met Lisa Price, which is one of my besties.
Yeah.
Wow.
I missed it. I gotta go. Okay.
Yeah. But while I was there, I met this woman, and she, her name was Sister Prema, and she had a beautiful T-shirt that said, "Teach a what did she, what did it say? It was like teach a woman, teach a woman, teach a nation, or something like that.
Mhm.
When you teach a woman, you're educating the nation, because
Yes.
we as women and as mothers, we birth children, and we are you know how it goes,
Right.
Yeah.
right?
They go
So
out in the world.
I I think, I think it's just so powerful what each of us can do in our own, even like small ways. It could just be family, friends, your own children, other pregnant women that you see. I mean, I'm sure you guys probably see some pregnant women sometimes and you're like, oh, I want to go talk to them.
Oh, I do
Yeah.
it all the time. The first question I ask is, "How are you?"
Yes.
Yeah.
The first question I ask. We're gonna talk about no advice. How are you? How are you doing? And the question, like this one woman, I remember I was in the grocery store and she had just had her newborn and and I was like, "How are you?" And she was like, "It's so hard. It's so hard." And she was just like, "My husband tries, but it's so hard." Like she just had a full breakdown. And I was like, just that one question.
Mm-hmm.
When you know and you understand, when
Yep.
you look around, when you've been there, to
Mhm.
ask someone, "How are you doing?" Like that's all it takes sometimes.
And
you
maybe
know?
just knowing what resources are, or
Yes.
just and if you see resources you don't necessarily need for yourself, like just grab them, or
Yes.
point people in so you can point people in the right direction, because
Yes.
people they take you up on that.
Yeah.
And I'm plugged Kindred Space LA, of course. We have our Instagram page, Kindred Space LA. We're
Yes.
always posting resources, not just for ourselves, what we're doing, but anything that we hear of around the country, because people need them, and it keeps people alive.
Yes. You know, we're talking about the factors that contribute to what affects Black women in this space.
Right.
And then of course there's racial biases, right?
Right.
Which come through on the other side when we hear,
Absolutely.
the strong Black woman, "Oh, you're not in that much pain. You're denying,
You're just being combative.
you're being combative.
Because you're Black.
Dramatic.
You're being dramatic.
Yeah.
You're just so. I heard someone tell me on Friday, I was at a session with folks who had received grants from a nice, wonderful organization. We were all together, and one of the women there, she's a nurse for 19 years, beautiful Black woman, and she was saying she was checking in on her client in the hospital, and the mother had some high blood pressure issues. They had her on magnesium, but the level was too high. And the mom was like, she said, "Can I use your arm for a second?" She picked up her arm, and she said her arm just fell. Like the mom was so out of it, and she kept going, saying, "Something's wrong. Something is wrong." Like, and they told this woman, who is a nurse, "Oh, she just don't want to get out of bed." So after repeated attempts at telling them something wasn't right, they came and checked the level of magnesium that they were giving her, and it was an amount that was much higher than it was supposed to be. And that this woman almost like even had a period of not breathing after they began to kind of investigate on what was going on and some other health issues. Right. So, that kind of dismissiveness, that bias that exists in the system, because you think about it, like and I'm sorry to say, you can't just have a Black face and that automatically means you're going to give good care to your Black sister or
Girl.
brother.
Look, when I was pregnant with Peace, or when I was going into labor with her, I was at 7 centimeters, and one of the nurses that came in, she was like, "Why are you screaming?" She just like kept belittling what I was doing, and I, very not in the nicest way, told her to get out. I was like, "Get out of I don't want you in here.
Good.
Bye." I'm like, it was so frustrating. I'm like, I'm having a baby, lady.
You don't get to decide how I express my
bye.
experience.
But
Run along.
yes, and so I mean, I wish I could say there are some studies that say if your baby is in the NICU and you have a Black NICU doctor, that your baby will have a better chance of survival. There are studies that point that out, but we've seen maternal deaths happen under Black physicians who are challenging, and I've had other times in my life where I'm like, God, why are you allowing me to see this, and why are you putting me in the space with this energy, and to see how it turns out, and just to be devastated because we don't even have the space to talk about, you're a Black doctor or care provider, and you doing harm. It's that internalized
Yep.
racial oppression that people can walk around with when they have skin like ours, when they can come from the same cultural background from ours, but they can't, but they're still dismissing you as a Black person. They're looking down on you. That happens too. So you really want to look for providers and support. Like, it can look different ways. Be open to it. It might be the Latino man that's got your back.
Or the Asian man.
Or the Asian man.
Or the
Or
Jewish
the
man.
or the Jewish
I
man.
had when I had Zen, my OB, he was fantastic, like was so amazing. The whole entire experience. He wasn't even supposed to be on shift, but made a point to come and make sure that I was okay. And I had what is it? I forgot what it's called, but when your body is producing too much of the hormone that's making your
Relaxant.
yeah. I forgot exactly what it was, but I was in so much pain, like the majority of my pregnancy with Zen. But he made sure that he came and was like, she's not supposed to deliver on her back. She needs to be like this. But it was like, I was like, I just love that little man. He was like,
Shout out
his
to
name is
that little
Dr.
man.
And I was like, you're just fantastic.
Little
yeah.
man, Dr. Man.
Yeah, he was just
I
a little
love that.
man and always made sure I was okay.
Yeah. But that's important.
I wanted to say, and I shared this with Kim too, back to the statistics of what's actually in the medical system. So when I was on my journey of finding a doctor that would support me through my VBAC wishes, I found a doctor who had a really great success rate. He took me in and he was like, hey, like I was doing preliminary interviews. And he's like, yeah, you're a great candidate. He's like, but let me pull up my calculator. And this calculator, it's
not the VBAC calculator.
It's the VBAC calculator.
Which they're not using that anymore.
Thank goodness.
That's some BS.
Okay, because he literally put my stats into a system. And he was like, oh, he said off the record, like he was like, based off of your health and your current condition, age, weight, all of that. He's like, yeah, you're a great candidate for VBAC. He's like, but I'm a data guy. So he gets his little iPad out and puts my age, weight, health history, whatever, puts me in as African American.
Right.
And South Asian, Indian and Black, basically. And my success rate for a VBAC was significantly lower than when he put me in as other.
Isn't that
not
so
African American.
This is a whole episode in itself.
Yes.
I'm starting to get triggered.
That was the one that right there when I saw that. And he acknowledged, he was just like, look, this is going to change for you the minute I take. And, based off of the statistics that are running through the medical system, they will determine and predetermine how it's supposed to go for you based off of racial biases and statistics. And so that to me was immediately like, thanks, but no thanks. I'm not here to be a data-based figure with you. I need you to be a healthcare provider personally for me. And so as much as he was a great doctor, I knew it wasn't the space for me because he was operating in that space.
Yeah. And so thank you for saying that. But they don't have no time to know you as an individual, Melanie. I've got to use this algorithm because I got 5 minutes with you and I got to see somebody, I got to see 20 more people today. And so if I can use the algorithm, then I don't need to get to know you. I can just, right here it says, this is the thing. And so that is a part of the problem of the brokenness. And when we talk about, midwifery, like one of the reasons we want to grow more midwives is because midwives can handle we're very good with low risk people and we know how to get people who are becoming high risk to doctors, but we can actually help with the maternal health care crisis in the deserts if people would just use us like they do in every country in this world except the United States. So, but we also, we're working on creating better systems, but now that people are all talking about midwives and doulas, don't get me wrong, doulas are fantastic, but doulas can't solve the healthcare crisis. And it's felt like there's been a lot of energy in getting doulas into this crisis, but we as midwives are like, wow, how do you gonna overlook midwives?
Yeah,
because the doula can't deliver the baby,
right?
Yeah, I don't. I mean, this is just like on the outside. I don't know if people are overlooking, though they're still scared of like, what does that mean to have a birth out of a hospital?
Right, but midwives work in hospitals too.
Yes, but I don't think people understand.
But
like,
people don't know that.
It's still a learning.
I know. I'm not. Listen, we need all the doulas.
Yeah.
We need all the doulas. Well, what's the difference between a doula and a midwife? A doula is amazing emotional, physical support, educates the pregnant person, the family, the client, has meetings with them prenatally. has meetings with them postpartum. I mean, is there to be continuous support in the labor? And often, like when I encourage all of our clients to have doulas, because in that early labor part, like the doula gets to go and be with the family when the mom's like, wow, what is this? What's happening here? And it's too early for them to be with me, but they still have that continuous support. They, they'll come with them to their birth, they'll be there. And if they transfer to the hospital, or if someone, is birthing in hospital, obviously your doula can be there. So doulas are amazing, but they don't catch the babies, right? They can't actually do medical care. They actually are not. That's part of being a doula, is that you're not medical. And right, so we need all the things for all the people.
My friend lives in Amsterdam, and she
said they were concerned about safety.
She said that in Amsterdam, she had her first baby here. She moved to Amsterdam. She said that there everybody gets a midwife.
Yeah.
She was like, it's actually very rare for you to go to a doctor.
Right.
She was like, you get a midwife first, and they encourage home births, and then you go to the doctor if you have a high risk pregnancy.
Exactly.
But that's it. That's the only reason why you go.
Most countries around the world use
I know,
midwives
I'm
in
like,
some
It's
form
so
of capacity.
different though. It's just so wild how.
But okay, so
here-
where does that come from? So
Well-
that's where you have to go back to the history of Black midwifery, and this kind of connects with your question, because guys, like when folks were brought over to work this country, midwives were targeted to be brought over. Why? The labor force was our babies, was
Yeah.
us, our bodies, and our babies' bodies. And so midwives, they're very valuable. Who else gonna birth these babies?
Right.
They know all the things. They birthing the babies. They're a respected member of the community, and they're not just birthing their fellow enslaved folks' babies. They're birthing white folks' babies, and whoever, right? Because if you look at that history, it's deep, and it's almost like a fairy tale, but it's true. And the reason why it seems like a fairy tale, because no one's talking about it, right? And so, but what happened was that when slavery, when we weren't able to bring, there was a time period where we could just keep bringing bodies, but that ended, and then we could only breed here in this country to make more enslaved people. Okay, that's our history. And when slavery ended, you started to see, this kind of trend to kind of get rid of the midwives. And I'll just say it accelerated in the 19th century, right? So in the 1900s, 1940s, up to the 1950s, the South still had a plethora of Black midwives. I'm talking about like 45,000 Black midwives in the South. And still up to 1955, by like 1970s, they were all kind of systematically wiped out, in the sense that they were laws created so they couldn't practice anymore.
Is it like a money thing?
Well, yes, because Medi-Cal came in the 70s. And so the idea was that they were going to have people travel to hospitals to birth with doctors. And the only way you could become a midwife is if you became a nurse now, and then went to the nurse midwifery program, which was very racialized towards white women. And those certified nurse midwives actually became kind of like, if anything, more like the assistants to the OBs. So it turned the way that we receive maternity care on its head. Definitely for territorial reasons, but I also and money. But I also think about it, y'all. Like when our ancestors were birthing in those times, in the times of slavery, they were bred to have lots of children.
Right.
And so now, when those bodies can't be used in the same way, do you think you want to have us having a whole bunch of kids? How about we put some controls over our bodies and look at how it's reflected in our reproductive health rights being taken away? It's all the same thing. It's all the same thing. Thank you for opening up about birth control and all that kind of thing, because that's another thing. We have to talk about fight for your lives. I don't care what your beliefs are about abortion, whether you have, you think it's wrong, you think it's right, but you have to understand that sometimes, like, what's being included in abortion is like therapeutic care for pregnant women who have pregnancies that are could potentially kill them.
Mhm.
It's
Right,
and
right.
there is an article that just came out that my partner just sent me last night, and I posted it on my Facebook page today about doctors in Louisiana. You know, abortion is illegal in Louisiana right now, and doctors talking about they won't even see a pregnant woman till she's 12 weeks. Yes, this is happening right now in the U.S., guys. Your OB will not see you until you're 12 weeks, because if you come in by 12 weeks, you have less risk of miscarriage. If you come in before 12 weeks, let's say you're having some bleeding, then that doctor can get arrested they might see that miscarriage as an abortion.
Mhm.
And the doctors can get arrested or fined up to $200,000 per incident.
What
So
in
do you
the
understand?
hell?
Yes.
So people could die that way
And
too.
people are dying.
Yes.
But think about it. So people say the system is broken, and I've said it, but it's like, actually, maybe it's working as it was designed.
Oh, it is always, the system is always working.
Mhm.
That's the
Right.
one thing we have to be clear on. The system is always working. If you are steadily appalled, then the system is working.
Exactly.
It's not working when we all feel free and liberated.
Mhm.
That's when the
And
system
supported.
is broken.
Right.
So, in thinking about Black Maternal Health Week, and thinking about what you do and all of our experiences, could you share even just 2 things that you think every pregnant or wannabe pregnant person should know to best prepare themselves?
That's a great question. Maybe what I would say is, I mean, the truth of the matter is, how many of us find ourselves pregnant? I did 5 times. I have 6 kids. Sorry, guys, it's true.
Twice. I found myself pregnant twice.
found
2
myself
times out of 4.
Twice. I've got 2 kids, twice.
So, I mean, you know, I would say, number 1, don't expect someone else to teach you about your body.
Mm-hmm.
I would say, do what you have to do. Look, we have social media. Back in the day, I had encyclopedias.
Go to pee for pregnancy.
So did we really?
Yep.
Right?
Come around and sell
just
the
got the internet.
encyclopedias to your house. Somebody should let a strange man into your living room selling you encyclopedias and come back every month with a new volume,
letter. New letter. You get a letter
They do
at a
that in
time.
Canada?
That is wild.
Really?
That was our
I never
information
had a man
source.
with the encyclopedia.
That's
No.
an American thing too.
Really?
Yeah.
You are also a little bit younger than us.
Yes.
But
Oh.
nobody coming in with an encyclopedia,
Okay,
y'all.
yeah, that was a thing.
The internet was
Oh, I was
And
around.
the phone
What?
used to be connected to the walls
Right.
too.
Back
We
in our
remember
day,
when the internet
but
started.
no,
Yes.
not an encyclopedia.
dial
man.
up.
Yes.
There was a milkman.
But the
Okay.
truth of the matter
Yes.
is, we can learn about our bodies.
Yeah.
Like what
We have
learn
apps.
we have all I mean, we have so much. I mean, Erica Chidi, our friend Erica Chidi, she's got the Loom app, which I
love
think
Erica.
really talks about you know, we have information at our disposal. So learn about your bodies. Learn how to really take care of your bodies. Set some intentions about a pregnancy, right? Because I think that, you know, no judgment at all. All of us can find ourselves, not me anymore, find ourselves pregnant. But like, I think we need to kind of, especially for us, we need to kind of think differently.
Yeah.
We need to kind of like take a step back and just be really intentional about what we're doing with our bodies.
Yeah.
Number 1. And who and what we're doing with our bodies.
Yeah,
for
Okay.
real. And what? She said it.
And so, and then, you know, not to use this as like a scapegoat kind of thing, because I hear a lot of mainstream medical professionals say things like, the most important thing is preconception health, and then we wouldn't be in such trouble. But preconception health really is important. And you know, a lot of us are saying, I want to have a baby, but what's your health like?
Right.
What are you doing? What is going on in your body? What things you need to set the stage for this healthy pregnancy and journey that you want to be on. And it's really mind, body, spirit, right? It's more than just a
Yes.
physical. It's
Yeah.
your mental.
That's what I was
Yeah.
gonna say. I'm like, that mental piece. When people are like, I want to have a baby, it's like, yeah, but you got to get your mind.
Yeah.
You know, it's just
Yeah.
everything is together.
Mhm.
Yeah.
It's not your baby. Once you will realize is not a doll.
No,
It's
far from it.
Chucky doll.
I think Melanie just realized.
Not Ashley saying a Chucky doll.
Right.
I mean, it's just
Yeah.
so life changing. And I think sometimes we
Yeah.
want to skip ahead to like, oh, that looks so cute. Oh, that
No.
baby's so
Dress
cute.
up.
I want, yeah.
Yeah.
And as you know, all of us know, it is so not that.
I got over
Yeah.
that real quick. I was like, you know what? You about to wear the same thing.
And I think too, and I would say definitely, one thing about pregnancy that's so cool as a person who provides healthcare for people when they're pregnant is that it's actually a health check-in. I realize that a lot of us aren't going to the doctor every year or just getting a check-in. And so, but when you're pregnant, we're taking your blood, we're seeing what your blood count, we're seeing what your glucose looks like, we're seeing what your blood sugar, like we're checking you for STIs, we're doing all the things. It's amazing health check-in. And so it can actually also become, if you're not quite amazing when you first come in for care, I know in our care, we're really great coaches on how to get you in a better, more healthy state. And it can be the healthiest time of your life. And postpartum can be the healthiest time of your life. So it's like, listen to the wisdom of folks that have done it before in a way that you connect with.
That part, because you can listen to a lot of folks that you don't connect with, and they cause fear and anxiety. Whew.
Yeah.
Sorry, that was
So
that struck me.
It's true. And so start developing, like, what's your support system going to look like? And you don't want to be around the fear mongers.
No.
They cannot support you in that way, So,
That's so true.
it's that kind of work and that kind of advice that I would give folks.
I know
I
that's
love
right.
that.
I know.
Good.
You're great.
We have a question of the week. Let me read it to you, and maybe you could give us your advice. Okay. So it says, toddler mom here, dealing with a picky eater. Any tips and tricks to get my little one to try new foods and eat consistently? Right now, he's only into chicken nuggets and mac and cheese and all kinds of fruit and yogurt.
Well,
Good food groups.
sure. I love this question. And I want to just say toddlers are notoriously picky eaters.
Yes.
Like
you're right.
it's not, there's nothing wrong.
Don't stress yourself out.
That baby is eating some protein. They got a little variety.
I heard fruit and yogurt. That's good.
That's fruit, yogurt, chicken, it's no really. And I think there's ways that of course you can like sneak vegetables into things, you can make your kid doesn't eat spaghetti sauce, apparently.
Smoothies?
Yeah, like smoothie. Yeah, you can try the things to get them to try new foods, but usually they'll just kind of stick to the things that they like for a period of time and then guarantee this person that their kid is going to eventually be like, I don't like that anymore.
Yeah.
And they're going to stick to another 5 groups of food. But you can try introducing like a new food once a week and just keep repeatedly trying it, putting it there with the things that they like to eat. And sometimes they'll eventually try a little bit, but I really honestly wouldn't stress about it.
Yeah.
And I feel like their kid sounds completely normal. And I bet they have all the energy, they're doing all the things, they're not lacking, so I think they're doing a great job.
Yeah.
I
That's
think
the answer.
good. Yeah.
I was like, that's the answer.
So frustrating. Actually, my 12-year-old eats like that. And I'm like, every day she's taller. So I'm like, well,
Something's working.
that
Yeah.
cacio e pepe from Trader Joe's is working really good.
exactly
That
Add
one is a
some
good one.
shrimp,
That's the one you're talking about.
That's good. But
It's
no,
good.
Agatha has a rule. She has 100 tries rule where she said that you should give something to a child 100 times before they can say no. Yes, because their mind changes so much. And it's just what you said. I literally put spinach on my 2-year-old's plate every day. And she's like, no, I don't want it. Ew, yucky, it's nasty. And her sisters will be like, look, I'm eating my spinach. And she's like, I don't care. Shoot. And guess what she's eating now?
Yep.
Spinach. Because I kept putting it on her
So
plate
wait,
every
is it
single
100
day.
times consecutively or like
Yeah.
100
A
times?
lot of spinach in the trash.
I
Dang.
just put I literally
Little
put
piece.
like this much.
Yep.
Just
Yeah.
so that she sees it and understands it's a part of her meal.
Yep.
She's 2.5. She just now started eating.
But come on, but can we just go back to when we were that age?
Yeah, no.
I have
But can
no
we?
idea.
We
That
just
part.
go
I'm
back.
that age now. I'll be
I'll stay there for a little while. Somebody take care of me.
Now. What do you mean? Ew.
Love it.
Ooh, child. Well, thank you, Kim.
You're so
We're
welcome,
so
guys.
grateful.
I am too.
We appreciate you.
I appreciate you too. I hope it wasn't too sad.
No, this was
It's
informative.
How can it be
It's
sad when you're
informative
such a
as heck.
light?
And empowering.
Yeah.
I didn't feel any sadness personally.
Yeah.
gave
It
us
was
a-
just I feel informed.
Okay, great.
Yes.
Yeah.
And I hope a little bit empowered. Like
Absolutely.
lot
a
of it.
little
Absolutely.
less like there's
100%.
nothing I can do.
No, no,
and
no,
just
no.
like well, there's so many things that we can do. And
No.
especially in community. So Also, thank you, Cody, for inviting me to Mama's Den podcast.
You should come every month.
I
You know
love
what I
it
mean?
here, and it
Let's do
just
this.
feels so great to just hang out with y'all. And I admire all y'all, and
Aw.
you guys are just amazing.
We love you.
Thank
We
you,
love you
Kim.
so much.
And thank you to our listeners. All right. Hopefully you're finding us wherever you get your podcast, and that tomorrow you're going to watch us on YouTube because every Tuesday is Mama's Den Tuesday on YouTube.
That's
So you're gonna get to
amazing.
see Kim's beautiful face.
Yeah, she's
Aw.
gorgeous, honey.
Gorgeous, darling. I need the
Thank you.
skin routine
Youthful, right? Youthful
and the diet
radiant.
because I'm like some from the inside out is working for sure. It's all that good work you do.